Assalamu alaikum students. In today's class, we'll discuss one more important topic of the GIT, that is the oral cavity, the pharynx, as well as the esophagus. These are the three topics we'll cover: oral cavity, pharynx, as well as the esophagus. These are the specific objectives related to this topic. Describe the anatomy of the oral cavity, including the boundaries, parts, as well as nerve supply. Describe the anatomy of the palate, which includes the hard palate as well as the soft palate. Okay, the muscles, nerves, and blood supply. Then we'll discuss about describe the anatomy of the tongue, the structures, muscles, motor, and sensory nerve supply, blood supply, as well as lymphatic drainage. Then describe the anatomy of the pharynx and esophagus, the extent, length, parts, relation, blood supply, nerve supply, as well as the lymphatics. So these are the specific objectives we'll cover. To begin with, what is this oral cavity? What do you mean by oral cavity? It is nothing but the mouth which extends from the lips in the front to the oropharynx behind. So oropharyngeal isthmus, this is the opening of the oral cavity into the pharynx, that is called as oropharyngeal isthmus. Opening of the oral cavity into the pharynx, that is called as oropharyngeal isthmus. From the lips in the front up to behind the oropharyngeal isthmus, the junction between the mouth and the pharynx. So this is the oral cavity or the mouth. So this oral cavity is divided into two parts. One is called as the vestibule, which is a very small space between the teeth and the gums. Between the teeth, gums here on one side, and the lips in the front, as well as the cheek on the sides. Okay, so this is a small space. If you see here, if you lift the lip, the space here between the teeth and gums and the lips or the cheeks on the sides, the space is called as the vestibule. The space between the teeth and gums and the lips, the small space which is between the this gums and the lips, this is called as vestibule. It will receive the opening of the parotid duct opposite the second molar tooth. So we have the incisor teeth, canine, then molar, premolar, and just beside the second molar, there is a small opening here. So here also you can see opening. This is opposite the second molar tooth. That is for the opening of the parotid duct. Parotid duct. Okay, so that is the opening. This small space, even though it is very small space, there is a very important opening. That is the opening of the parotid duct. Again, the second upper molar tooth, there is a small opening. This is called as the vestibule. The opening of the parotid duct into the vestibule. Vestibule is this whole space between the lips and the gums. Now going further, so now we'll see the actual mouth cavity proper, oral cavity proper. The small space that is called a vestibule. Now we'll see the large space which we saw in this picture. So this whole space, this is large space. Small cavities is called a vestibule, and this is the oral cavity proper. Okay. It lies within the alveolar arch, gums, and the teeth. So it will lie. So you can see here again, going back to this picture. So this is called as the alveolar arch, inside the lips, deep inside the lips and the gums, deep to the gums actually. It is deep to the gums. That arch is called as the alveolar arch. Then we have the gums and the teeth. Inside that, whatever cavity is seen, that is called as the oral cavity proper. It has the roof on the top. So if you see, this is the, if you take a longitudinal section, this is how it looks like. This is the roof formed by the palate, which has two parts, the hard palate and soft palate, we'll see later, and the floor formed by the anterior two-thirds of the tongue, this is the tongue. So on the roof is formed by the palate, and the floor is formed by the anterior two-thirds of the tongue. Okay, so again you can see here, so this is the oral cavity proper, this is the roof formed by the hard palate, and floor is formed by the tongue. It communicates with the vestibule behind the third molar tooth when you close your lips. So the communication, only communication between the oral cavity proper and the small space vestibule is behind the third molar tooth. Here also oral cavity proper, and here is the vestibule. So the only communication between the vestibule and the oral cavity proper is behind the third molar tooth. These are the three molar tooth, first, second, and third. So behind that will be the third molar tooth. Now coming to the under surface of the tongue, what is below the tongue? Okay, so this is if you lift the lift, if you lift the tongue, this is how it look like. Okay, so the most first important structure which you will observe will be this structure called as frenulum linguae, or the frenulum of the tongue in the midline. It is in the center. Okay, so this is very important structure. Sometimes it becomes shortened, that leads to tongue tie, something called as tongue tie, where the person cannot communicate properly, he cannot speak properly if this becomes shortened. This is called as the frenulum of the tongue. It connects the undersurface of the tongue to the floor of the mouth. So it will be connecting the undersurface of the tongue to the floor of the mouth. Two orifices of the submandibular duct as well as the sublingual duct both will open here. The submandibular duct opens on each side of the frenulum. So on each side there will be small openings here. Okay, so that will be the opening for the submandibular duct. Parotid duct we have already seen second beside the second upper molar tooth. Now the submandibular duct will open beside the frenulum, and the lingual fold, sublingual fold, formed by the underlying sublingual salivary gland. So there will be a fold here. This is called as the sublingual fold on either side. This is because deep inside will be the salivary gland. Okay, sublingual gland. So sublingual will be deep to that. Okay, so that is called a sublingual fold because there is sublingual gland deep inside. Now coming to the palate, the roof. Roof is formed by the palate, as we saw. The palate forms the roof of the mouth. It is divided into two parts, the hard palate and the soft palate. What do you mean by hard palate? What do you mean by soft palate? Hard palate is bony palate, which is made up of bones. That is called as hard palate, bony palate. Behind that, there is a muscular part, which is also forming the roof. So, but it doesn't have bone, but it has the smooth muscles. Okay, that is called as the soft palate. Now you can see here, this is the picture showing you the hard palate. Okay, so this is the hard palate, which is made up of bone. This is the roof of the oral cavity. Hard palate is formed by four bones. Palatine process of the maxilla. If you can see here, both these two bones are called as the palatine process of the maxilla. Maxilla bone is maxilla, and it has a process called as palatine process. And in between there is the intermaxillary suture. So this is the palatine process of the maxilla, and horizontal plates of palatine bones posteriorly, and behind we have two bones, again two bones. These are called as the horizontal plate of the palatine bone. Palatine bone has two parts. One is the horizontal plate as well as the pyramidal process. So the roof is formed by the horizontal plate of the palatine bone. So the roof is formed by four bones, 1, 2, 3, and 4. The first two bones are the palatine process of maxilla. Then we have the horizontal process of the palatine bone behind. So these four bones will form the roof of the oral cavity. It is bounded laterally by the alveolar arch of the maxilla. If you see here, this is called as the alveolar arch. This bony part here, which is called as the alveolar arch, into which the teeth are fixed together. These are teeth fixed into the bone. This is called as the alveolar arch. Behind it is continuous with the soft palate. Behind here will be the soft palate. It is not shown here because it is on the bones. Behind this bony part will be the soft palate. It forms the floor of the nasal cavity. This bony part is not only forming the roof of the oral cavity but also the floor of the floor of the nasal cavity which is above. Okay. Now you can see here this is the soft palate behind. So here is the bony part, hard palate. Now behind you can see the soft palate. So it is a mobile fold formed of a bag of mucous membrane filled with striated muscles. It is filled with the skeletal muscles or the striated muscles within the deep muscle. So there will be muscles, muscular parts. So it is called as soft because the muscles are soft. Okay, and it is lined by mucous membrane. It is attached to the posterior border of the hard palate. It is attached to the posterior border of the hard palate, as you can see in this picture, previous picture. So here will be the attachment of the soft palate. From here, it will extend down. Okay. Its posterior border is conical projection called as the ula. So if you see, if you go behind the free border, this is the free border. This is attached border which is attached to the hard palate. So here is attached part and this called as the free part. So this free posterior border, it has a projection called as ula. It has a projection called as ula, which moves whenever you say ah, it will move behind. Okay. Coming to the muscles of the soft palate. So what are the muscles of the soft palate? There are 5 pairs of muscles. Which are those? These are called as the tensor palati, or they are also called as the tensor velli palati here. Then we have the levator palati. This is also called as the levator velli palatine. Then we have the palatoglossus. This is the palatoglossus muscle. Then we have the palatopharyngeus. This is the palatopharyngeus. Then musculus ulae you have already seen. Deep inside will be a muscle called as the musculus ulae within the ula. So these are the 5 muscles which will be forming the soft palate. Now coming to the nerve supply of the soft palate. Okay, so the motor nerve supply of this muscles of the soft palate, which will help in moving of the palate, is supplied by all the muscles of the palate are supplied by the pharyngeal plexus. Pharyngeal plexus except the tensor palati, except the tensor palati is the first muscle here. All other muscles are supplied by the pharyngeal plexus. Okay, except the tensor palati, which is supplied by the mandibular nerve. The motor innervation of the soft palate can be tested by saying ah. So whenever you want to check the muscle are intact and the nerve supply is intact, ask the person to say, open his mouth and say ah. When he say ah, it will move behind. Normally, soft palate rises upwards and ula moves backwards in the midline. Very important is it has to move in the midline. If it is deviating any side, then there might be some kind of paralysis or paralysis. So this is a very important test to do. Very simple and easy test to do. Okay. Coming to the sensory supply, it is by the maxillary nerve. Maxillary nerve through the greater palatine as well as lesser palatine nerves as well as the glossopharyngeal nerve. So this is the sensory nerve supply of the soft palate. Coming to the movement of the soft palate, pharyngeal isthmus. Okay, so there is a very important structure in the this area. This is called as the pharyngeal isthmus. This is the pharyngeal isthmus here, which you can see here moving. So it is the communicating between the nasal and oral parts of the pharynx. So this is called as the nasopharynx. This is called as the oropharynx, and this is the laryngopharynx. Behind the nose is the nasopharynx. Behind the oral cavity, the oropharynx, and behind the larynx is the laryngopharynx. So the communication between the nasopharynx and the oropharynx, this is called as the pharyngeal isthmus. Pharyngeal isthmus. It is closed by raising the soft palate upward. So whenever you say ah, so the soft palate will go and touch the posterior wall of the pharynx. So it will be totally closed. So The closure occurs during the production of explosive consonants in speech as well as swallowing. Whenever you are swallowing or making loud noise, at that time you see that the soft palate will move, go and touch the posterior wall. Soft palate is raised by the contraction of the elevator palati as well as the palatopharyngeus like this. So it will be moving like this. Okay, so this is the movement which will occur whenever you move the. So this is the movement we can see. Okay. At the same time, the posterior wall of the pharynx is also pulled forwards, and the palatopharyngeal muscles on both the sides also contract so that the palatopharyngeal arches are pulled medially like the side curtain. So if you see here, even the palatopharyngeus muscle. So here is the palatopharyngeus muscle will move closer to each other so that it will pull like a shutter. It will be pulled like a shutter and it totally closes. So from above that soft palate is moving down and the palatopharyngeus is moving on the medial side. So it will totally close the communication. By this means the nasal part of the pharynx is closed off from its oral part. So this is the ula. So it will go and touch behind and it will close the nasopharynx from the and cuts the nasopharynx from the oral pharynx so that the food doesn't go into the nasal cavity. Now coming to the next structure, that is the tongue. So this is a very important structure within the oral cavity, the tongue. It's a mass of striated muscle covered with the mucous membrane. It is a thick muscular structure covered by the mucous membrane. So they say there is no bone in the tongue. Okay, so it is mainly muscular part. So its anterior 2/3 lies in the mouth and the posterior 1/3 lies in the pharynx. If you see here, this is the anterior 2/3 of the tongue, which lies in the oral cavity, and posterior 1/3 is the posterior 1/3, which lies in the pharynx, oropharynx. It is attached above to the styloid process and the soft palate. So it will be attached to the styloid process and the soft palate. We'll see if you saw the previous picture. So here you saw that it is attached to the soft palate. So from muscle from here will be passing. So that muscle is called as the palatopharyngeus. So palatoglossus. Okay. So this is the muscle which is going from the glossus means tongue, and the palate is connected. So it is called as palatoglossus. Okay. So it is attached to the connected to the above to the soft palate as well as the styloid process. Below it is attached to the mandible. As you can see here, this whole muscle will be taking origin from the mandible. Okay, as well as even the hyoid bone. Hyoid bone is the small bone here, so it will be attached to the hyoid bone as well as the mandible. Mandible will be completely here, but here it is shown only the front. It is cut section. Functions of the tongue, very important function is one is the normal articulation of the jaw. So articulation of the jaw. So whenever the jaw moves, the tongue also moves, and it helps in the chewing the food, mixing of the food, manipulation of the food, all will be taking place by this. As well as it also helps in swallowing. How it helps in swallowing? Whenever the tongue wants to swallow, so it will be push and touches the hard palate, and the food is pushed into the esophagus. So this is how it helps in swallowing. And a very important function is taste. All the taste buds are on the tongue. So one of the very important function of the tongue is the taste. And also in speech, even though the voice box is here in the larynx, but the articulation of the tongue helps in the making of words. Okay, so it is very important helping the speech. Okay, so these are some of the functions of the tongue. Now coming to some of the muscles of the tongue. What are the muscles of the tongue which are there? Okay, there are two types of muscles. One is called intrinsic muscles, which are nothing but the smooth muscles, and the extrinsic muscle, which are the skeletal muscles. Okay, so there are two types of muscles, as you can see, intrinsic muscles and extrinsic muscles. The intrinsic muscles are not attached to any bone, so they are soft muscles. and they are not attached to any bone. They consist of the longitudinal, transverse, and vertical fibers. As you can see here, there is superior longitudinal muscle fibers, so which run from the posterior to anterior part up to the tip of the tongue. So these are superior longitudinal. Then below that will be inferior longitudinal muscles. Then we have the transverse muscles. Transverse will be running like this, one from one side to the other side. So these are the transverse muscle. Then there are vertical muscles here. Vertical muscles here. Okay, so superior longitudinal, inferior longitudinal, transverse muscles as well as the vertical muscles. These are the intrinsic muscles. What do you mean by intrinsic muscles? They are smooth muscles and they have no attachment to any bone. Action, they alter the shape of the tongue while it lies in the mouth cavity. So they will alter the shape of the tongue, whether to make the tongue long, short, broad, thick. All those movements are done by the intrinsic muscles. Now coming to the extrinsic muscles of the tongue. Which are the extrinsic muscles of the tongue? So the extrinsic muscles are four pairs because they are on either side. Okay, so they attach to the bone and the soft palate. So the difference between the intrinsic muscle and extrinsic muscles are extrinsic muscles are attached to the bone. The intrinsic muscles are not attached to the bone. Okay, so they are one, the palatoglossus. So here you can see this is the palatoglossus muscles. Then we have the styloglossus. Below that, this is the styloglossus muscle, which is attached to a styloid process and coming into attached to the tongue. So this palatoglossus is attached to the palate, soft palate, and coming down to the tongue. Okay. Then we have the genioglossus, which is coming from the mandible. Genial, there are small tubercles here called as the superior and inferior genial tubercles. So this muscle is taking origin from here and going to the tongue. So genius called as genioglossus. Then we have the fourth muscle called as the hyoglossus, which is attached to the hyoid bone. This is the hyoid bone here. So the muscles are going up. So these are called as the hyoglossus. So depending on the origin and insertion, they are named. Okay. Palatoglossus, as the name indicates, coming from the palate, soft palate, and going to the tongue. Styloglossus, coming from the styloid process, going to the tongue. Glossus means tongue. Genioglossus, genial tubercle, as I said, is on the mandible. From there to the tongue, genioglossus. Hyoglossus, taking origin from hyoid bone and getting attached. Okay, so as soon as you know the name, you also know the name of the muscles here. Okay, so as soon as you know the name, you also know the origin and insertion of these muscles. Okay, all muscles of the tongue are supplied by the hypoglossal nerve. Hypoglossal nerve is the last cranial nerve, 12th cranial nerve, except the palatoglossus, which is supplied by the pharyngeal plexus. Pharyngeal plexus. All other muscles are supplied by the hypoglossal, except the palatoglossus, which is coming from the palate, and that, as we have seen already, the palate is supplied by the pharyngeal plexus. Now coming to the sensory innervation of the tongue, very important sensory innervation of this tongue. The anterior two-thirds, the general sensation is by the lingual nerve. The general sensation, this is the sensory part, and here is the motor part shown in the tongue. Okay, this is called as the anterior two-thirds of the tongue. This is the posterior one-third. Okay, so this is anterior two-thirds and this is the posterior one-third. So the anterior two-thirds of the tongue is supplied by the lingual nerve. Lingual nerve. General sensation is by the lingual nerve. But the taste sensation, which are very important for the taste, are from the chorda tympani nerve. Chorda tympani of the facial nerve. So the taste fiber, excluding the vella papillae, it is all supplied by the chorda tympani of the facial nerve. Okay, so the taste sensation is mainly by the chorda tympani, and the general sensation of the tongue is by the lingual nerve. This for the anterior two-thirds. Okay, what about the posterior one-third? The posterior one-third, including the vella papillae, all general sensation is by the glossopharyngeal nerve, and general as well as even the taste sensation is also by the glossopharyngeal nerve. So for both it is same nerve, glossopharyngeal nerve, general as well as special taste sensation. But for the anterior two-thirds, the general sensation is lingual nerve and the taste sensation is by the chorda tympani nerve. So here is the glossopharyngeal nerve, which is both for the sensory as well as special or the taste sensation. Then the root of the tongue and the epiglottis. Behind that, the root of the tongue and the epiglottis is the general and taste sensation are carried by the vagus nerve. So this is the sensory nerve supply, sensory innervation of the tongue. Okay. Now going to the motor supply. So we'll talk about that. Okay. The motor supply of all the muscles of the tongue is by the hypoglossal nerve. All the muscles of the tongue are supplied by the hypoglossal nerve. That is the 12th cranial nerve, as we have already seen. So all the muscles, all the hypoglossal nerve supplies all the muscles of the tongue except the palatoglossal, which is supplied by the pharyngeal plexus. So this is the motor supply. This is the sensory nerve supply. Okay, so this is very important. You should remember this. Okay. Now coming to the pharynx. So pharynx. So till now, do you have any doubts? Any doubts you have? Let me take your attendance. Just a minute. Okay. Now going to the pharynx. Okay. So the pharynx is a muscular tube which is behind the nasal cavity, oral cavity, as well as the larynx. So this part here, this is called as the pharynx. It is a muscular tube. It extends from the base of the skull. From the base, here is the skull base. Okay, this is the nasal cavity. This is the oral cavity. Okay, so from the base of the skull to the 6 cervical vertebra, this long, this whole thing is called as the pharynx. And this will, from the 6th cervical vertebra, it continues below as the esophagus. So the pharynx will continue below from the 6th cervical vertebra below, it will be the esophagus. So the beginning of esophagus will be the 6th cervical vertebra. So above that, this whole thing from the base of the skull up to the 6th cervical vertebra will be the pharynx. It is funnel shaped with the upper expanded end and a narrow lower part. If you can see here, the upper part is much more broader compared to the lower part. As it goes down, it becomes narrow and narrow so that it can open into the esophagus. Okay, so it becomes narrow. So it is funnel shaped. Okay. Now coming to the subdivisions of the pharynx. So how it is divided? So because it is behind the nasal cavity, mouth, oral cavity or the mouth as well as larynx, so it is divided to 2 parts. So it will be communicating, each part will be communicating with the respective area. So it will be divided to 3 parts. The part which is communicating with the nasal cavity, that will be behind that, this is called as the nasopharynx. So behind the nasal cavity is the nasopharynx. Behind the oral cavity, so behind the oral cavity, this is the OP, or OP means oral cavity, oropharynx. Okay, so this is the NP, nasopharynx. This is the OP, oropharynx, and below here is the larynx. Behind the larynx, this is called as the laryngopharynx. So these are the 3 parts of the pharynx: nasopharynx, oropharynx, and laryngopharynx. Nasopharynx will communicate with the nose, oropharynx will communicate with the oral cavity, laryngopharynx will communicate with the larynx. So its anterior wall is deficient because it is communicating anteriorly, so it is opening anteriorly, so the anterior wall is deficient, it is open, but the posterior wall is totally closed. Posterior wall is totally closed, but the anterior wall is deficient or it opens. So here you can see again, this is the picture showing you the behind the, this is the nasal cavity, behind the nasal cavity the nasopharynx, behind the oral cavity the oropharynx, behind the laryngopharynx is the laryngopharynx. So the posterior wall is totally closed, but the anterior wall it's communicating with the nasopharynx will communicating with the nose, oropharynx with the oral cavity, laryngopharynx with the larynx. So anterior wall is open or it is deficient. Now coming to the what are the muscles which will be of the pharynx. Muscles of the pharynx are also divided, just like in case of tongue. These are also divided into 2 types, but they are called as the the constrictor muscles as well as the longitudinal muscles. Constrictor muscles, superior, middle as well as inferior constrictor. Longitudinal will be the salpingopharyngeus, palatopharyngeus, and stylopharyngeus. So here you can see these are the muscles which are called as constrictors of the pharynx. Constrictor means they will be helping in closing of the pharynx. Constrictors. Okay. So these will be also called as the horizontal muscles, longitudinal and horizontal. Constrictors muscles are the superior constrictor. This is the middle constrictor and this is the inferior constrictor. These are the three constrictors: superior. So this is superior, this is the middle as well as this is the inferior. So they are all joined behind posteriorly and overlap each other and it is totally closed behind. So this is how it looks like. This is the superior, middle and inferior. But if you see it from behind, from posterior, it is totally closed. Superior, this is the middle and the inferior. Overlap over each other and they are totally closed. But anterior, if you see, it is communicating anteriorly, deficient. The three constrictor muscles overlap each other like the segments of an antenna. As I said, posterior, they will be overlapping over each other. Each one fans out from its anterior attachment and passes posterior around the pharynx horizontally. So they are moving horizontally. So as I said, they are also called as the horizontal muscles. Okay, because they are horizontal. Because the other three muscles are longitudinal muscles, which are long. So they are vertical muscles running from row downwards. Which are those? One is called as the stylopharyngeus. Where is the styloid process? This is the styloid process, which will be the base of the skull. From there, this muscle is going down. So that is called as the stylopharyngeus from here. So this muscle is coming here. This is called as stylopharyngeus. So the styloid process just beside that. This muscle come all the way here. This is the stylopharyngeus. Then we have the salpingopharyngeus. Salpingo means the eustachian tube or the auditory tube, which opens from the middle ear to the nasal cavity or the nasopharynx. So it is opening here. So this muscle will be running from the auditory tube below downward. So it is called as salpingo. Salpingo is also the other name for the auditory tube. Salpingo pharyngeus because it is going to the pharynx. The third muscle is the palatopharyngeus, which is coming from the soft palate. We saw palatoglossus, which is going through your tongue. Now one muscle is coming to the pharynx. This is called as the palatopharyngeus. Palatopharyngeus. So there are three muscles, longitudinal muscles. One is called as the stylopharyngeus. Then we have the salpingopharyngeus and the palatopharyngeus. As the name indicates, stylopharyngeus starts from the origin is from the styloid process going to the pharynx. The salpingopharyngeus from the auditory tube into the pharynx. Palatopharyngeus from the soft palate to the pharynx. So as the name indicates, they are telling the origin insertion also. So there are three longitudinal and three horizontal muscles. There is the superior constrictor, middle constrictor, and the inferior constrictor. Then we have the stylopharyngeus, the salpingopharyngeus, and the palatopharyngeus. So these are the six muscles. Now coming to the innervation, the nerve supply of this pharynx. So what is the nerve supply? All the muscles of the pharynx are supplied by the pharyngeal plexus. All the muscles of the pharynx are supplied by the pharyngeal plexus except again there is exception, stylopharyngeus, except the muscle coming from the styloid process, which is supplied by the glossopharyngeal nerve. Glossopharyngeal nerve. So all other muscles are supplied by the pharyngeal plexus except the stylopharyngeus, which is supplied by the glossopharyngeal nerve. Now coming to the sensory innervation. So the nasopharynx will be supplied by the fifth nerve, that is the maxillary nerve. The oropharynx is supplied by the ninth cranial nerve, that is the glossopharyngeal nerve. And the laryngopharynx is supplied by the 10th nerve, that is the vagus nerve. So this part, sensory innervation is by the vagus nerve, lower one part. Laryngopharynx, oropharynx will be by the glossopharyngeal nerve, and the nasopharynx will be maxillary. So this is the sensory innervation, and the motor innervation is all the muscles are supplied by the pharyngeal plexus except the stylopharyngeus, which is supplied by the glossopharyngeal nerve. So do you have any doubts still here? Any doubts? Okay, we will move further. Okay, so we'll move further, going to the esophagus. So we already studied the oral cavity, the tongue, and the pharynx. Now going to the esophagus. Esophagus. So now we'll study about the esophagus. So here you can see here is the esophagus going down all the way up to the abdomen. So it is a long muscular tube structure about 25 centimeters long. It is a very long muscular tube, almost 25 centimeters long, beginning from as a continuation from the pharynx. As we said, the pharynx ends at the sixth cervical vertebra and it continues as the esophagus. So the beginning of the esophagus will be from the end of the pharynx, that is the sixth cervical vertebra. So here will be the pharynx. Below that will continue as the esophagus down. Okay. So it pierces the diaphragm at the level of 10 thoracic vertebra. This long tube goes all the way from the posterior mediastinum into the abdomen. It opens into the abdomen by opening through the diaphragm. So this opening will be at the 10th thoracic vertebra and it will join with the stomach. It will continue as a very small part as the abdominal esophagus and continue into the stomach. So it has three parts. One is called as the cervical part, the part of the esophagus which is in the neck, that will be called as the cervical part. The part which will pass through the thorax behind the heart in the posterior mediastinum, this will be called as the thoracic part, and a very small part before it opens into the stomach will be called as the abdominal part. So these are the parts, the cervical part, the thoracic part, as well as the abdominal parts. Now coming to some of the important relations, because esophagus is a very important structures and it can go into carcinoma and other things, structures, many things. So you should know the relation. What are the relations of what are the structures which are very close to the esophagus? So we have to study some of the important relations. Posteriorly, so as you can see here, this is the esophagus here. So posteriorly we have the vertebral column. So vertebral column is totally behind that. So it is surgically very difficult to approach from behind and there is no room for the esophagus to expand behind. Laterally, on either side of the esophagus, we have the lobes of the thyroid gland. So here is the thyroid gland, which is in front of our trachea, but the lobes will go behind and they will be on sides of the esophagus. As well as anteriorly, if you see here, will be the trachea. So in the front we have the trachea, behind we have the vertebral column, and on the sides we have the lobes of the thyroid gland, as well as even the carotid artery, vagus nerve, interjugular vein, the carotid sheath whole complete. Everything is there on the sides. Now coming to the thoracic part. So the thoracic part is below here, which is behind the heart. So in the thorax, it passes downwards and to the left through the superior and posterior mediastinum. So initially, as soon as it enters from the neck into the thorax, it will enter the superior mediastinum. Then it will go behind the heart. This is called as the posterior mediastinum. Okay. At the level of the sternal angle, the aortic arch and the left bronchus push the esophagus again to the midline. So initially it will be going towards the left side, but because of the arch of the aorta and the trachea, again it is pushed towards the midline. So as you can see here, this is the esophagus here, going all the way this is in this neck, and then in the superior mediastinum, and now it will be here, and then it will go behind the heart. Okay, so here is the esophagus. It is slowly going toward the left side again, but by the arch of the aorta and the trachea, again it is pushed back to the midline. So this is the esophagus complete behind the trachea. Now coming to the anterior relations of the esophagus in the thoracic part. Very important relations are there. One is the trachea in the front, as you can see in the previous picture also. Here we have the trachea. Okay. So here also you can see the same trachea here. the front, esophagus is behind this brown color, and is the trachea in the front. Then the left recurrent laryngeal nerve, very important relation, okay, which might get damaged and leads to hoarseness of voice, okay, which is supplying the larynx. So this left recurrent laryngeal nerve will be also in the front anteriorly, as well as the left bronchus. Left bronchus will cross the esophagus. Okay. Then we have the pericardium in the front. Below here will be the heart, and it's covering the pericardium. Okay. So all these are the anterior relations. So here you can see here. So this is the heart in the front, and the esophagus is going behind here. So trachea is in the front, esophagus is behind, vertebrae are behind, and in the front is the heart, and it's covering the pericardium. Okay. Now coming to the posterior relations, we saw that it is totally in contact with the vertebrae. Here is the esophagus, and here it has been cut so that you can see what are the posterior relations of the esophagus. Posteriorly, if you see, one is the thoracic vertebrae as well as their intervertebral disc. Along with that, you can also see the thoracic duct. Thoracic duct is the largest lymphatic duct, which is beginning from the abdomen, going into the thorax, and opens to the venous system. Then we have the azygous vein. Azygous is the azygous vein. Then right posterior intercostal arteries. If you can see here, this is the intercostal vein, intercostal arteries, everything will be there. Okay, descending thoracic aorta at the lower end. So if you see behind that, the arch of the aorta come, and then we'll be having posteriorly the descending aorta. If you see some of the pictures, so if you can see here, so this is the descending thoracic aorta, which is going behind the esophagus. Behind that, posteriorly, we have the descending thoracic aorta. So these are some of the important relations. As you can see here, this picture also showing you this is the esophagus coming and opening into the abdomen. And here is the descending thoracic aorta, which is also opening into the abdomen behind the esophagus at a lower level. Now coming to the lateral relations. What are on lateral side? On the right side, we have the right mediastinal pleura on the right side, and the terminal part of the azygous vein. We already saw this is the azygous vein, and it is terminal part. On the left side, we have the left mediastinal pleura. Here will be the left pleura as well as lung. Left subcostal artery. So left the subclavian artery will be there, as well as if you can see here. So here will be the left subclavian artery, as well as the aortic arch. We can also see the aortic arch here, as well as the thoracic duct. The thoracic duct will be especially on the upper part, will be on the right side. On the left side. Okay. So these are some of the important relations of the this esophagus. Now coming to the esophagus and left atrium of the heart, what is the relation? So is there any relation? How it is important? So this is the barium meal, or the barium swallow, which is passing through the esophagus, and in the front is the heart. So esophagus cannot be usually seen. If you give the barium swallow through, then it can be seen by the barium swallow. The front is the heart. There is a close relationship between the left atrium of the heart and the esophagus. How it is important, how it is clinically, it's a clinical application. So whenever you pass the barium swallow in the esophagus, it will help the physician to assess the size of the left atrium. So if you want to see whether it is dilated or not, so just ask the person to have the barium swallow. Okay. So as the barium swallow goes down behind the heart, it becomes narrow and narrow. So it means that the left atrium is enlarged, as in case of the heart failure. Okay, especially the heart failures, which will easily indicate whether there is any dilatation of the left atrium. Okay, as in case of the heart failure or long-standing mitral stenosis. So this esophagus, this test will easily help the diagnosis of the heart problems. Now in the abdomen part, the smallest part is the abdominal part of the esophagus, very small part, just 1.3 centimeters. As soon as it enters the, we have seen it will open into the abdomen at the level of the thoracic vertebra. Then it goes descend downwards, and just 1.5 centimeters in the abdomen. Then it opens into the the stomach. Okay. The anteriorly it is related to the left lobe of the liver. As you can see the relations, anteriorly it is related to the left lobe of the liver, and posteriorly it is related to the left crust of the diaphragm. This is the esophagus, and here you can see this is the right crust, and behind is the left crust. This is the left crust. Okay, left crust of the diaphragm, which is behind. Fibers from the right crust of the diaphragm form a sling around the esophagus. Even if some of the fibers from the right, which is the right crust, some of the fibers will form a sling around the esophagus. This is important because it acts as a sphincter. At the opening of the diaphragm, the esophagus is accompanied by the two vagi on either side. We have the right and the left vagus, as well as the branches of the left gastric vessels, as well as the lymphatics. Now coming to the esophageal constrictions. As I said, one of the very important clinical application is usually you will have the carcinomas as well as the constrictions because of the carcinoma or the structures. Okay, so before we know the abnormal pathologies of the esophagus, we should know what are the normal constrictions. There are some normal constrictions. So whenever you ask the person to swallow the barium swallow, there can be normal constriction. So don't imagine it to be abnormal. So you should know the normal constriction to identify the other abnormal constrictions. So normally there are three anatomical constrictions. One is at the junction of the pharynx with the esophagus, or the beginning of the esophagus, or the junction between the pharynx and the esophagus, or the end of the pharynx. So here, so the beginning of the esophagus, this pharyngoesophageal site is also the site for the constriction. Esophageal constriction is called as the esophageal constriction. First, at the junction with the pharynx, 16 centimeters from the incisor teeth. So these are the incisor teeth. So it will be almost 16 centimeters from the incisor teeth. Why it is taken from the distance from the incisor teeth? Because if you want to pass any tube like the Ryle's tube to do the gastric lavage, so as soon as you push the tube, it might get stuck here. So when you get stuck, just pull it and pass it deep inside. Okay, this means it is normal constriction. You approach the first normal constriction. The second constriction is at the crossing of the aortic arch and the left bronchus. So this is the crossing of the left bronchus and the aortic arch. Okay, this is the second thoracic constriction. Okay. Then the third constriction is at the junction with the stomach. Okay, or sometimes it is said at the diaphragm, as we saw that the right crust and left crust will form a sling. So this is called as the diaphragmatic constriction, inferior esophageal sphincter. So where there will be the third constriction. So this is almost at the level of the 38 to 40 centimeters from the incisor teeth. The second constriction is almost 23 centimeters from the incisor teeth. This distance is measured from the oral cavity from the teeth, as I said, because if you are passing any tube, so normally they have some difficulty when they are passing through at this point. So when you feel the difficulty, just pull it, as I said, and push it slowly, and you should know this is normal constriction. If there are any other constriction apart from that, then you know these are abnormal because of some pathology, carcinoma or something like that. So they have considerable clinical importance, as I said. Okay. So what are the importance of these esophageal structures or constrictions? They may cause difficulty in passing the esophagoscope. So they have difficulty in passing the esophagoscope. So esophagoscope, as I said, I was talking about the Ryle's tube. You can feel this is a very thin tube, but esophagoscope is actually a thick tube, much thicker compared to the Ryle's tube. So when you pass this esophagoscope to see the esophagus inside of the esophagus, then you might feel difficulty at this passage at this point. The second is in case of swallowing of the caustic liquids, okay, like the acids, mostly in children, this is where the burning is worst and stricture develop. So these sites where they are constricted, these are the worst side, especially the upper part. is the first one to cause strictures. There will be worse burning and there will be strictures developing at this point. The esophageal strictures are a common place of the development of the esophageal carcinoma also. These are also because there is regular friction because of constriction when you're eating food or drinking water. So at that time, it might lead to, especially lead to friction. So that's why it is a sunnah to sit and drink the water and to drink in 3 sips, not at a time, large volume of water, so that there can be a severe effect on these constrictions. Okay, so that's why it is a sunnah to drink in 3 sips as well as slowly with patience and all these things. Because if whenever we drink water, it leads to a lot of wear and tear at these structures, and it leads to development of the esophageal carcinoma. So as I said, in this picture, what is the importance of scale? As I said before, so this is very important to pass whenever you're passing tubes, any types of esophagoscope or rise tube at this particular distance, you will feel the constrictions. Now coming to the blood supply. So the upper third is supplied by the inferior thyroid because there's a very long tube esophagus. So it is uh, long muscular tube. So it is supplied by many arteries. The upper one third will be supplied, which is in the neck, is supplied by the inferior thyroid artery. The middle third, which is present in the thorax, it will be supplied by the thoracic aorta, and the lower one third is supplied by the left gastric artery, which is coming from the celiac artery from the abdomen. Okay, so this is how the blood supply of the esophagus is there. Upper third by the inferior artery, middle third by the thoracic aorta branches from the thoracic artery. As you can see here, these are branches coming from the thoracic aorta, and the lower part by the left gastric artery. Coming to the venous drainage, the upper one third is also drained by similar veins, the inferior thyroid vein, the middle third by the azygous vein. So these are the azygous vein as well, hemiazygous veins. Then the lower one third will be by the left gastric vein. Left gastric vein will be draining, which is a very important point for the portal portal vein, where there will be portocaval anastomosis. Very important site for the portocaval anastomosis. So here will be the gastric left gastric vein, which is drawing the lower one third. So upper one third by the inferior vein, then middle one third by the azygous and hemiazygous vein, and lower one third by the left gastric vein. Now coming to the lymphatic drainage. Lymphatic drainage is also divided upper one third, middle one third, and lower one third. Upper one third by the which is in the neck will be drained by the deep cervical group of lymph nodes. Middle one third by the superior and inferior mediastinal group of lymph nodes, para and para-aortic group of lymph nodes, and the lower one third will be in the abdomen into the cilia group of lymph nodes. So this is the lymphatic drainage. So this is all about the oral cavity, the tongue, the pharynx, and the esophagus. So if you have any doubts regarding this, you can ask me now. Do you have any doubts?
Thank you, Doctor.
Okay, thank you very much. Thank you.